So welcome back for this afternoon session about biotics-based strategies, and we have first to welcome Dr. Diana Knight from Royal Canin. Diana graduated from the University of Pennsylvania, and after 10 years in clinical practice in the US, she joined Royal Canin Global Scientific Support Team in 2020. So please welcome Diana for this session.
Thank you very much. Thank you for that lovely introduction. So today I'll be speaking to you about a very specific yeast probiotic, Saccharomyces cerevisiae, variant Boulardii, CNCM I1079. And for the purposes of this, I'll probably shorten that to S. Boulardii for most of the presentation. But we have some very promising research into its impacts on several areas of pet health. So just as a brief introduction, this particular variant, S. Boulardii CNCM I1079, is a non-pathogenic, non-colonizing, non-spore-forming yeast. It was first isolated from lychee and mangosteen. And it's been studied, the original S. Boulardii has been studied for its effect in humans since the 1970s, for its benefits in gastrointestinal, immune, and reproductive health. Some of you may know it on the market for humans as ultra-lever in France. This particular strain in the studies that I'm going to describe is CNCM I1079, and it has been developed by our partner, L'Allemande Animal Nutrition, specifically to be adapted to small animals. Some of those specifications are its optimal growth at 37 degrees, its better survival in an acid pH to survive the stomach environment, and its faster oxygen consumption in the colon, creating a very good anaerobic environment for the development of beneficial bacteria. Relative to gastrointestinal health, S. Boulardii helps augment villus height, thereby increasing the area for nutrient absorption, and improves tight junctions, limiting intestinal permeability. It also helps scavenge oxygen radicals, and by reducing the anaerobic conditions, improves the microbial balance and helps intestinal resilience. In terms of immunity, S. Boulardii can help limit the inflammatory response, which improves natural defenses. When it comes to reproductive benefits, S. Boulardii appears to impact the maternal microbiome and thereby fetal and neonatal metabolomics. Today, I'm going to take you through some of the research we have into S. Boulardii in healthy adults in stable environments, with dietary challenges, with the physiologic stress of early life changes, and finally, in lactation and gestation. We've got limited time for this presentation, so I'm not going to be able to cover every statistically significant finding of each study, but rather I'm going to try and offer an overview of some of the benefits, trying to really touch on the unique aspects of S. Boulardii CNCM I1079 compared to other probiotics. The first study I'm going to describe was in healthy cats and was conducted by L'Allemande Animal Nutrition in collaboration with the Università di Torino. The results of the study have been presented at the Pet Food Forum in 2025 in Kansas City in the United States. The objective of this first study was to evaluate gastrointestinal and immune parameters in healthy adult cats supplemented with the established dose of S. Boulardii compared to placebo over a 5-week period. The parameters that were evaluated included microbiome and gut health, as well as local immunity and inflammation. As for the experimental design, after a 1-week adaptation period, 20 healthy adult cats were randomly assigned to either a control or S. Boulardii test groups. The cats were fed Royal Canin Adult Sensible to maintain their body weights. Each day, one group received a capsule containing S. Boulardii, while the other received a placebo of maltodextrin. Up to day 35. Fecal samples were collected from all cats at day 0, and then once weekly from day 21 to 42 to measure fecal IgA, calprotectin, and indole-scatol contents. At 4 weeks, the microbiota composition was analyzed, focusing on alpha and beta diversity, as well as the identification of discriminant bacteria through linear discriminant analysis effect size. There were some very exciting results of the study. Firstly, there was a shift in the microbiome. Most notably, increased concentrations of Faecalibacterium, Phascolachrobacterium, and Peptoclostridium, which are involved in short-chain fatty acid production and protein fermentation. This was accompanied by a statistically significant improvement in alpha diversity, which, as we've already discussed today, is a generally accepted indicator of a healthier gut microbiome. So with administration, we saw beneficial shifts in the microbiome. In addition, supplementation with S. boulardii led to statistically significant reductions in fecal calprotectin. Lower fecal calprotectin levels mitigate intestinal inflammation, thereby making the gut environment healthier. Statistically significant increases in the production of fecal IgA were also present and show support for intestinal immunity. Finally, after 4 weeks of supplementation with S. boulardii, cats had statistically significant reductions in indole and scatol levels, which you can see here. Indole and scatol are byproducts of protein fermentation, two types of putrefactive compounds that contribute to unpleasant fecal odor. This finding, especially in cats, where we have pet owners living in close proximity to litter boxes, is really important for livability for pet owners. As a final note about this study, I just also want to mention that the results of the study were repeated in 3 consecutive studies in cats and 1 in dogs, which have not yet been published, but demonstrate the consistency of the benefits that we see with S. boulardii administration in healthy animals. I also just want to highlight that it's very challenging to achieve these types of responses in healthy animals who are already normal. So we're very excited about these results. The second study I'd like to discuss was also performed by Lallemande Animal Nutrition, and an abstract highlighting its results was presented at ESVCN Congress in Belfast in 2024. This study involved supplementing dogs undergoing an abrupt diet transition. The purpose was to investigate the impact of supplementation with S. boulardii on fecal score and microbiota composition after a gastrointestinal insult or challenge that could be mimicked by this type of diet transition. During this 42-day randomized, double-blinded, placebo-controlled study, 40 healthy intact adult beagle dogs were divided into 2 groups, a control group and an S. boulardii supplemented group, and balanced in terms of age, sex, and body weight. After a 14-day adaptation phase, with diet 1 with no supplementation, both groups were given diet 1 for the initial 4 weeks of the study and were beginning to have supplementation, at which point they were then switched to diet 2 for phase 2 of the study, the final 2 weeks. The 2 diets were isoenergetic, but differed in their crude protein content, 25% for diet 1 and 40% for diet 2. From day 0 to day 42, each dog received 1 capsule daily, either placebo or S. boulardii, based on their assigned group. Evaluations included body weight, fecal sampling and fecal score, and blood work. Samples were taken weekly during phase 1 of the experiment, including just prior to the diet transition, and then at days 2, 4, 7, and 14 after the diet transition. Again, we have some very exciting results of this study. Here we have some graphs of stool quality. The S. boulardii group experienced a statistically significantly lower percentage of soft stools than the control group after the diet transition. That was 9% in the S. boulardii group and 26% in the controls. The feces classes on the graphs here have been averaged per period to generate a percentage of dogs in each category. But even visually, you can see there's much more green on the S. boulardii supplemented group. In terms of microbiome, both control and S. boulardii groups experienced a reduction in the alpha diversity of their microbiome after diet transition, which was measured by the Shannon index, as well as changes in its composition. That's something we might expect after a gastrointestinal insult like this abrupt diet change. However, the administration of S. boulardii attenuated these reductions and indicated that the administration of S. boulardii could improve the resilience of the gastrointestinal microbiome in periods of physiologic stress or challenge. This concept of improved intestinal resilience is seen in other studies we're going to discuss as well. So I just want to note that trend. We'll move on. And there were no other statistically significant differences between the two groups that I haven't discussed in this study. But again, very interesting because we often do have abrupt diet transitions, either planned or unplanned, in clinical practice in dogs. So a very interesting result. The next study in weaned kittens was conducted by our Royal Canin team in partnership with L'Allemande Animal Nutrition and has been submitted for publication in Animal Microbiome. The study evaluated the impact of S. boulardii on gut and immune parameters during early life transitions we commonly see in young cats, like weaning, transition to a new home, food changes. As for the experimental design, in this randomized, double-blinded, placebo-controlled 7-week supplementation trial, 40 domestic short-hair kittens who began the study at 10 weeks of age and finished at 17 weeks of age were randomized into either control or S. boulardii groups. At 12 weeks of age, kittens in both groups were vaccinated. At 14 weeks, they were all subject to a room change to simulate a period of transition or a physiologic challenge that might mimic these early life events like adoption. And between 15 and 16 weeks of age, they were subject to a diet transition to Royal Canin Kitten Dry. Throughout the study, clinical signs, body weight, and food intake were monitored daily. In addition, feces were collected weekly over a 4-day period and measured for fecal moisture and fecal IgA. Fecal microbiome was evaluated at baseline and at weeks 2, 4, and 7 of the study. Blood work evaluations were performed at 9, 12, and 17 weeks of age to evaluate total IgG, response to vaccination, and perform hematobiochemistry. So, in terms of gastrointestinal health, stool quality remained in the optimal range on average for both groups throughout the study, which is a result we might expect from healthy kittens. However, supplementation with S. boulardii statistically significantly increased stool firmness at weeks 1, 2, and 5, with trends at all time points. Fecal moisture was also statistically significantly decreased at week 5 in supplemented kittens. Also, during the week of room transition, a simulator for that physiologic stress, fecal quality actually improved in the S. boulardii kittens. And finally, 8 out of 12 control kittens were scored as always having optimal stool quality versus 12 out of 20 S. boulardii kittens. So there was a 50% increase in those kittens who had optimal stool quality throughout the study. I'm actually going to skip over some of the results on microbiome and immunity because we have a short time and some of it's been discussed in other slides or will be discussed. But similar to the prior study, supplemented kittens had an attenuated reduction of microbial diversity relative to control counterparts in response to the challenges they saw. Repeating this result in kittens is really important, I believe, because although research into the microbiome and its impact are still in development, there is some indication that while microbiome in adults typically returns to normal after an insult, the microbiome in pediatric patients may be more malleable, and it appears that there are some more lasting shifts before 1 year of age. So relative to these changes, it may be clinically relevant in our patients. Our final study for the day is a study performed by L'Allemande Animal Nutrition in collaboration with NeoCare. The study has been published in Frontiers. Up to now in our discussions, the results we've seen from S. boulardii may be what we would expect or hope for in a very effective probiotic of any kind, gastrointestinal and immune benefits. But I wanted to go deeper into some of the findings that really set S. boulardii apart as a probiotic. This study is a bit more complex than the prior studies I've discussed, so I won't again be able to cover every detail. But I also want to mention we're lucky enough to have 2 members of the NeoCare team, I believe, in the audience today, who may be able to help me answer any questions that I cannot after the presentation. The purpose of this study was to investigate the impacts of supplementation with S. boulardii in bitches during gestation and lactation on both the dams and their puppies. The investigation was comprehensive, including indicators of microbiome and gut health, milk composition, puppy growth, and immune and metabolomic factors in puppies. For the methodology, in this randomized, placebo-controlled, double-blinded study, 36 bitches were selected at day 28 of gestation, as confirmed by ultrasound by a veterinarian. Bitches were randomized into either control or experimental groups according to breed, size, age at mating, parity, BCS, and fecal score. The experimental group received 1.5 times 10 to the 9 CFU of S. boulardii per kilogram of feed, which is the standard established dose. In terms of maternal data collected, body weight and a 9-point BCS were assessed on day 28 and 56 of gestation, as well as day 28 and 56 postpartum, and food intake was measured daily. Feces were collected over 3 consecutive days and pooled beginning at day 28 and 56 of gestation, as well as days 1 and 56 postparturation, for evaluations of fecal dry matter, fecal IgA, and evaluations of the fecal microbiome. Blood samples were collected on day 56 of gestation. After parturition, reproductive analyses were performed, including litter composition, i.e. how many live versus stillborn puppies there were, evaluations of colostrum on 1 day post-parturition, and milk at day 7 postpartum. This included evaluations of IgG concentration on colostrum and IgA concentration on milk, as well as protein and lipid assays and gross energy calculation. In puppies, body weight was taken in the first 12 hours after birth, and puppies were assessed and APGAR scores were performed on all puppies except those born between 9 p.m. and 4 a.m. Puppies were then classified into quartile groups based on breed and body weight, with quartile 1 being the lowest and quartile 4 being the highest, using previously acquired breeding data to suggest whether they were small or large relative to their expected size. Temperature and blood glucose were obtained at day 1 postparturation. 2 growth rates were then calculated, one for days 0 to 21 postparturation, and one for days 26 to 56 postparturation. At 1 day prior to vaccination and day 56 postparturation, blood work samples were taken to measure anti-rabies antibodies and cytokine levels. So first, from the maternal parameters, when maternal colostrum and milk were analyzed, it was noted that gross energy in colostrum was statistically significantly higher in the supplemented dams, as was the crude protein content of maternal milk. These findings are, again, very important because they support reduced early mortality and the growth and immune development of puppies. So a very interesting and unique finding from this probiotic. In addition, one really exciting finding was that there was a statistically significantly lower probability of low birth weight puppies in the supplemented group, with a greater percentage of puppies in the higher quadrants of the expected weight range. A very important finding because, as you know, low birth weight is a risk factor for neonatal mortality. And also, some of you may be aware, it's also a risk factor for obesity later in life. Supplementation with S. boulardii statistically significantly decreased the growth rate in the first 21 days of life and increased the growth rate between 21 and 56 postpartum, which is what we would expect as low birth weight is associated with accelerated early growth rates, catch-up growth. There was a statistically significantly lower weight differential between puppies also in the supplemented group, so we had a more homogenized growth. And that's really important for breeders because differential growth rates are very complex for them to manage. If I can summarize, overall in this study, it appears that supplementation led to a higher probability of larger and therefore likely healthier puppies with more standardized and easy to manage growth rates. So here we have a very complex picture of the diagram of the impacts of maternal supplementation with S. boulardii on the neonatal metabolome at 2 days of life. We see that 2 major nitrogen metabolic pathways are modified in puppies thanks to the supplementation of their dams with S. boulardii. So they were not supplemented, just to be clear, only the dams were, but we see these changes at day 2. Amino acids and purine metabolic pathways are changed. These changes are linked to bone development and growth, as well as diet metabolism, which in turn change puppy development in the neonatal period. This could explain why the S. boulardii group demonstrated a 1.5 times higher growth rate over the first 2 days of life than puppies in the placebo group. The support of catch-up growth is an excellent signal for reducing the neonatal mortality. Finally, when it comes to immunity, supplementation of mothers with S. boulardii also statistically significantly modulated the inflammatory status of their puppies before and after vaccination, while maintaining an appropriate level of specific IgD response to vaccination here. Prior to vaccination, levels of anti-inflammatory cytokines IL-10 and TNF-beta were lower in the supplemented group. Post-vaccination, IL-8 was significantly increased in that group, the test group, with IL-10 demonstrating the reverse trend. This changed the IL-8 to IL-10 ratio in the test group, which is an indication of a reduction in inflammatory markers in the supplemented puppies. It's important to note that this happened without any compromise to the immune response of the puppies. And in fact, specific anti-rabies antibodies showed a non-significant trend to be higher in the supplemented group. So we see a modulation of the inflammatory status of these puppies while we still have adequate immune response to vaccination. A very interesting result. In terms of impacts on the microbiome, at each time point, we see two clearly separated microbiota profiles between puppies born from the S. boulardii supplemented dams and the controls. If we look a bit deeper into the microbiota composition at day 0, we see that puppies born to supplemented dams have a reduced abundance of Pasteurellacea, which is clinically relevant as it can be related to fading puppy syndrome. At day 2 and 21, we see a greater abundance of Streptococcus luteaceae, and at day 21, also Lactobacillus species, which are 2 species that contribute to the digestion of milk. And at day 21, we see a reduced abundance of Enterobacteriaceae, which is associated again with fading puppy syndrome. And we see a greater abundance of Bacteroides and Bifidobacterium, which are again associated with better digestion of solid food. I just want to summarize a bit here some of the effects that we've seen with S. boulardii. It appears that S. boulardii acts as a gut flora stabilizer, helping to ensure a better resilience of the microbiota in response to physiologic challenges. It also supports stronger immunity and a better capacity to cope with early life challenges. Finally, there appears to be a fetal-maternal programming effect, whereby puppies benefit from maternal supplementation without actually being supplemented themselves. We believe that this occurs through S. boulardii's impacts on the microbiome, which in turn affect the metabolome and therefore the growth patterns, neonatal microbiome, and immune factors. I again would like to reiterate that these findings are very interesting as growing research suggests an association between microbiome and many disease processes, given that some studies suggest that the pediatric microbiome is more malleable than it is in adults. Helping to support the development of a healthy microbiome early on in puppies may impact their health later in life, something to be continued, that we need continued investigation on. Royal Canin is particularly concerned with promoting healthy start to life, so we're very excited by these findings. To wrap up, I want to quickly go through from the research we have where we might have good evidence for the clinical use of S. boulardii. These include reproduction to support puppies and kittens during periods of transition and increase the resilience of the gut microbiome, and also in adults in response to GI challenges like food transition or acute incidents of soft stools, as well as during periods of physiologic stress. We expect that S. boulardii will maintain its efficacy during antibiotic administration and indeed reduce the incidence of antibiotic-associated diarrhea as it does in humans. There's quite a body of evidence. So we have ongoing research in this area. One unique property I'd also like to mention of S. boulardii is that it's a yeast probiotic. That means it's naturally resistant to most commonly used antibiotics and also carries an extremely low risk of horizontal transfer of resistance genes. in the context that we have now of growing concerns about antibiotic overuse and risk of the development of multi-drug resistant bacteria. This is a really significant advantage of S. boulardii over other probiotics. And with that, I would just like to acknowledge all of the extremely hard work behind this research and thank the extended team, both at Royal Canin, led by our own Virginie Gallard, and also our partners, led by L'Allemande and, of course, NeoCare. Thank you very much for allowing me to present, and if there are any questions from the audience.
Questions? Mandine, do you have questions?
Perhaps I will start with one.
Go.
So, did you test more than one strain of boulardii, or?
No, this boulardii strain, again, was specifically developed by L'Allemande to hold up to small animal metabolism. And as it was developed really specifically for the small animal use, this is the strain we tested. And it's slightly different from that which was used in humans.
Yes, so my second question. So did you have an idea about what is different between those developed in human and for animals, or no?
Difference between, I'm sorry?
Human and which you use for animal?
So the strain that we have, it survives better in acid environments. Its optimal development temperature is slightly different, and it's a higher production of a higher consumption of oxygen radicals, basically.
Okay. So I will continue. So I see also the effect on immune response, but I don't know if you related that to the microbiome composition or not, but the anti-inflammatory effect. What you observe?
So I think it really relates to the alterations. We expect that the alterations in the microbiome modulate the inflammatory response that we're seeing through these changes to the metabolome.
So if I understand well, it will be an indirect effect through the microbiome, that's correct?
Mm-hmm. Yes.
Okay.
And unless there's someone from NeoCare who would like to contradict me on that.
I don't know for other people. So it is my last question if there is no other question. You mentioned, I didn't catch it clearly, that the boulardii decreases the diversity. That's correct, of the microbiome?
No, increases.
Increases, okay. So it was my part.
But there's a natural, so what happens is, just to clarify, in most of the studies that we've seen, what we see is that we have tested in several of these studies an insult. And we see in both groups a somewhat reduction of the diversity of the microbiome in response to that insult. So diet transition, the room change, there are many examples that are across experiments where we see a challenge to the gut. We see a reduction in both groups, but that reduction is reduced in the S. boulardii supplemented group. So we see that the S. boulardii supplemented group is more resilient to those types of challenges than the non-supplemented group.
Okay, thank you.
Thank you, Diana.